Well, you might think vaccine mandates are a thing of the past, but you'd unfortunately be wrong. Many in this country are still being required to vaccinate, namely college students around the nation at various universities are being asked to vaccinate and in some case even boost prior to entering their fall term. It's unbelievable. These are young, healthy people. We know now much more about the vaccines. We know that they are not stopping the spread. Many of these college students, in fact, have already had COVID, yet they're being required, if they want an education at the institution that they've been accepted to be vaccinated. But there are some people that are fighting against this. NoCollegeMandates.com is an organization founded by Joni McGarry and Lucia Sinatra that is working on ending college mandates across the country and helping parents and students become more informed and giving them resources on how they themselves can have some medical autonomy. Joining us now is Joni McGarry to talk more about what students can do in order to have that bodily choice. Where are we at with all of these mandates? Can colleges be sued if there are some complications with the vaccines? For example, myocarditis, which we know is a high risk for younger men. All of those questions will be answered. Joni, thank you so much for joining us. Welcome to the show.
Thanks, Kim. Hello, and thanks for having me.
So let's talk. I mean, this is crazy. A lot of people don't realize that in order for students right now to be able to attend their fall terms, a lot of them are being required to get the vaccine, to show proof of vaccination, and in some cases even a booster dose as well. And these are students, not the teachers.
Correct. At some colleges, faculty and employees are also mandated, but yes, at several hundred colleges across the country, the primary series is required for students to be enrolled, to be able to sign up for classes, to be able to go to classes, to be able to attend. And in about probably a quarter of those schools, boosters are required. And a couple of schools have already indicated that they will mandate the new bivalent product, which is not yet approved and has just about zero clinical data. So Wake Forest is one of those schools. So yes, this is continuing unabated, even though we now know that the justifications for these original mandates to stop transmission, to protect the population, no longer hold scientifically.
So when you're going around and discussing this with, I mean, I would imagine you're going and talking to the universities themselves. What's the reasoning for it? Because these are young, healthy adults that we're
Correct.
talking about. Like you mentioned, the professors, faculty, staff, a lot of them are being mandated as well. But the students, we're talking about the young students. What is their reasoning?
Well, every communication, we have several thousand stakeholders across the country, and many of us have directly contacted colleges. We've sent massive letter campaigns to these schools. The response that we've always gotten, if you get a response at all, because mostly the colleges just ignore any pushback on these, but the response is always a doubling down of CDC talking points. It used to be the prevent transmission, to protect the student. But now it's sort of morphed into we need it to remain safe and remain open. So there's not a lot of data or reasonable risk-benefit analysis that comes back to us.
So they just say, we're just doing it because we need to do
Doing it. Right,
because
exactly.
we're doing it.
And it makes no sense on the face of it because this is a population, as you said, 18 to 24 years old. They don't need this medical intervention. They're at just about zero risk of getting very sick or dying from COVID. Most of them have had COVID because the vaccines don't prevent transmission on campus, and they're not getting very sick right now. So our mission is very narrowly to end these mandates, restore medical choice to students on campuses. And stop the discrimination that is also on many campuses against the unvaccinated who have been lucky enough to secure a religious or a medical exemption, because there's different treatment of these groups and a lot of pressure and coercion.
Yeah, what happens? I mean, if a student does not want to be vaccinated and is at one of these universities, I know a lot of people will say, well, then they should just choose a different university. It's not that easy. Anybody who's applied to college understands that you're lucky to get in. I mean, you just hope that you're going to get that acceptance letter. So it's not exactly easy to transfer to a different university or to apply. There's deadlines for applications.
Right.
So if you're an entering freshman, I mean, it's too late. You'd have to miss this year of education. So, what can be done if you are a student and you've enrolled in one of these universities and they're now saying, now you need the booster. I mean, maybe you've already gotten your 2 doses, but you're just like, I really don't want the booster. And they're forcing you into it. What can you do?
Well, there are a number of things you can do. First of all, if you are considering colleges, don't consider colleges that have mandated. Just don't do it if you at all can. But the problem with that is, like you mentioned before, if you're in a state where you're relying on the state system of colleges to be able to get a more affordable education,
Like here in
like
California, I looked it
California,
up, and
yeah,
my alma mater is requiring the booster,
yeah,
UC Davis, and the
the
entire
UC
UC
system.
system is.
The entire CSU system and most of the community colleges of California, the whole SUNY system, very draconian measures. So first of all, try not to consider one of those colleges. But secondly, many people applied to universities, paid their tuition, only then to be faced with a change in policy. So that's an issue. And so, they were sort of stuck. But if you've had the primary series and you don't want the booster, push for an exemption, push for a religious exemption. You should be able to have a change in conscience. But it very, very much depends on the school. We found Jesuit universities to be very bad on religious exemptions. And
Really?
yet, yes, Boston College is one of the worst. They'll allow religious exemptions for many other types of vaccinations, but not for COVID-19,
Wow.
or they're very limited in them. So what you can do is try very hard not to comply. Get a religious exemption if you can. Medical exemptions are almost impossible to get because doctors are concerned about losing their licensure or getting disciplined by their medical systems for writing them. So that's very difficult. And often colleges will reject medical exemption requests from your own physician. I mean, we know of a girl at Union College who got expelled because she had so many problems with the first series, and she put a medical exemption for the booster, and they refused it. But anyway, what you can do is try to get an exemption. Lawyer up if you need to. You have a right to change your conscience, and you have a right to medical choice.
Yeah, unfortunately, even in the law firms, they've been, pushing lawyers to get the
Right,
vaccine and
right,
forcing them to be mandated. I mean, it's just, and when I found that out, I thought, gosh, if the lawyers are being mandated and they're not pushing back, even if they
right.
don't want to, what chance do we actually have? I mean, it's insane. I like that on your website at nocollegemandates.com, you do have a list. You have the comprehensive,
Right.
updated spreadsheet. And I was going through it, and it just, first looking at it, there are a lot of universities that are not requiring the
Right.
vaccine. So that is, something for people if they want to look into, if you're in high school now, I suppose, and you want to go to college. But so many of them do. And then even more shockingly, so many of them require the booster. And
Mhm.
again, in that age group, and at first I looked through the spreadsheet and I thought this must just be for anybody at the university. And I went to the top and I thought, no, it's students that are being mandated. This isn't just staff,
Mhm.
faculty, professors. So
Let
that,
me jump in there. Harvard requires the booster for its students, but not for their employees. Harvard. So make that make sense to me.
yeah,
Sorry to
that
interrupt
doesn't
you,
make
but it's
any
so
sense.
egregious.
Right.
Yes.
The older group that would be their professors, their staff, the faculty would be the higher risk group than the students. So why would the students need to get the vaccine? And then looking into the data a little bit more, what's interesting is the CDC actually uses the age group 18 to 29 as their barometer age group for how they calculate your risk,
Hmm.
based on, because and their reasoning, they said, well, 18 to 29-year-olds have more cases of COVID than any other group, right? So yet they have the one of the lowest rates of complications or death. I mean, they're at 0.7% of all COVID deaths are in that 18 to 29-year-old age group.
And I
And
like to see
and
that
yet they've
further
all had
broken down.
COVID.
Right. I
So
like to see that further broken down for comorbidities too.
exactly. And then when you go into it, what of those 18 to 29, of that 0.7% of all the COVID deaths that happened in that age group, how many of them were extremely vulnerable? And it would have been, something that they would need to take extra precautions for themselves personally, not necessarily. I mean, obviously the people around them, whether they get the vaccine or not, it's not stopping the spread. So there, that's something you'd have to individually take care of yourself for if you are in a high risk, vulnerable group.
Right.
It really does boil down to personal responsibility at this point.
And personal choice. I mean, I think that it's so clear that people should have a choice whether they take this product or not, because it does not protect anyone else around you, especially in this age group. And one thing I want to remember to touch upon is that this product carries a risk of myocarditis,
Right.
particularly in young men. So in this age group of college students, you have a higher risk if you're a guy of getting myocarditis from the shot versus any complications from getting COVID illness. So basically, a mandate is mandating that you take on this risk for no scientifically justified reasons. So that's number one. Number two, there's no long-term safety data for these products because they haven't been in existence long enough. And there is some evidence to suggest that we might be concerned about long-term reproductive system impacts. Now, we don't know yet, but just because we don't know means you should pump the brakes on this and not mandate an entire population to get these products to stay matriculated in schools.
And what we do know, based on the data, and this has been confirmed in numerous studies and data collected even in Europe and in the United States, is that it does disrupt menstrual cycles. We know
Absolutely.
that. So we don't know then what that means long term for those menstrual cycles. But I mean, a lot of people shrug that off and say, well, it's no big deal. I guess it's no big deal if you think that a menstrual cycle is no big deal.
Well, it's part of the reproductive system. So let's just pump the brakes a little bit. Give these kids and these parents and these families, give people a right to choose whether they wish to take on that risk. And that's really our basic mission. And you also asked, what can people do? People, first of all, they need to start making their voices heard. People are afraid to make their voices heard. They're afraid to stand up. They're afraid to go against the narrative, particularly on college campuses. And you can also participate in our letter campaigns. We have one now launching about the CDC revised guidance. It's been signed by a number of different law firms. We're trying to put colleges on notice that they lived by the sword for the CDC recommendations. Now they got to change their tune because the recommendations have changed. It's incumbent upon them to change their policies. We're sending that letter out. Right now we have over 240 schools that are going to get that letter, and thousands of stakeholders. So we rely on volunteers to get those letters out. It's a completely anonymous process. Email us and we'll hook you up for that.
Have you had any success yet?
Well, success is counted in a lot of different ways. We haven't seen a wholesale rolling back of these mandates. So in that respect, no. But we have reached over 2,800 trustees, stakeholders, senior administrators, providing them with new information in a very professional and data-based way. You cannot know who you're going to tip. You don't know what's really happening behind the scenes on that. So that's number one. But the success we have had is we've allowed stakeholders at different colleges to find each other. One of the challenges of being a college parent or a college student is you're not in the same town, you don't really know each other, especially the families, and you can't find each other of like mind because people are afraid to speak out. So we've provided a clearinghouse on our Telegram group and just by our presence in the world for people to connect, find out what's happening on the ground, and with that information, you can decide how you can best navigate the exemption process at your own school, or maybe avoid that school if you're a parent of a student looking at colleges.
Yeah, if you can, if you can
can
avoid it,
you can.
Yeah. One of the most the most shocking things about all of this is that I've noticed just anecdotally that a lot of the people who are totally pro the mandates or pro, using maybe what they call the carrot versus the stick, but even then the carrot is still really, a stick essentially. Right. Is that privately they'll say something to me like, well, but I know it doesn't stop the spread. I know it's almost privately they doubt. Mm-hmm. They say it publicly. It's almost like people are genuinely afraid. At these universities, there might be these administrators that privately, they each individually might feel like this is ridiculous. I mean, I got COVID, they got COVID, everybody got COVID at this point. It's not stopping the spread. Like, what's the point? But then collectively, they get into this hive mind and they're unable to speak out when they're together. They'll do it privately. Right. They'll confide in people and say, yeah, I know. But then together, and the same thing with students, the youth, they feel like, well, this is the trendy thing to say. We all have to stay, I don't want to be the outsider. Right. So I'm not going to say the thing that's going to make me the outcast. I'm going to lose my friends. And so collectively, they're unable, they just feel almost inhibited from saying anything. And it's the craziest thing to see people privately even confide in me. People who are publicly very vocal, pro all of it, calling people anti-vaxxers and then telling me, vaccine injuries in my family. I don't really know if I'd want to get the booster, or I had disruptions in my menstrual cycle, or I'm not sure. They start to express doubts. And I find that to be so, it really shows hive mind and what that's about,
Well,
And
and I think it also speaks to the pressure to virtue signal
yeah,
and to make sure that nobody suspects you of being an anti-vaxxer, whatever that even means. I don't even know what that means, right? But you don't want to voice your opinion because you're also afraid because nobody's doing it. So you don't, if you speak up, you provide cover for
yeah,
other people to do it. And people aren't willing to do that. Number one, there's a lot of social media pressure on these kids. There are social media kits that have been developed by the White House, by the American College Health Association to provide to student influencers to shame students into, toeing the line. So I agree, there's a hive mind. And also professors who have spoken out very vocally. There's a guy at Boston College, of course, Dave Collum at Cornell. They get a lot of pushback
yeah.
against their speak. So I think it requires people to start becoming brave because what you're doing by not doing that is you're handing a bunch of tyranny and bad policy to your children, to all the people around you. So we're just hoping people will speak up and provide others with cover for doing it.
Yeah, I'm wondering, and I don't know if you have the answer to this, but I am wondering if, we know that we're not able to sue the vaccine manufacturers, that they have immunity, if there
Right.
are any of these problems like myocarditis. So if you are a young man and you end up with myocarditis because your university has mandated that you get this vaccine, do you think you'd be able to sue the university?
That is an excellent question. Right now, we have not seen successful lawsuits going forward because universities are also covered under the PrEP Act because they're providing COVID countermeasures, right? So law firms, first of all, law firms have not been great on this. Judges have not been great on this. People are afraid to bring lawsuits because the judges have been so bad that you don't want to set bad precedent. We know of at least one case of a death of a student in the SUNY system, a community college kid. He died. It was ruled a vaccine death. It's tricky getting a lawsuit against the university because of that PrEP Act. What you can do is you can take your case to the fund that's been set up, but I don't even think anything's been paid out of that fund. It's a government fund. So right now, you're kind of out of luck. And the
Wow.
universities know of these injuries because a lot of these kids who are getting injured, they go to the health center. In
Right.
fact, there's a case at Brown that they definitely knew of a myocarditis from a vaccine of a student, and they stayed completely silent about it. We've been trying to bring pressure to bear on that. So
I mean,
it's
and that's a known side effect. We know this
we
now.
know it,
And
right?
and yet there's no recourse for for these injuries when you're mandated to take this, knowing that this is a risk. I mean, that's absurd. Well, Joni, how can people help? What can people do?
Well, what you can do is number one, go to our website, nocollegemandates.com. Look around for the resources that we have. We have a Telegram group. Sign up for our Substack newsletter. Send us an email if you'd like to participate in our new campaign. We'll hook you up with a toolkit. We make it easy. We provide the banner so that you can be anonymous. But what you can do individually really is start speaking your mind, provide others cover, make it normal to question these things, to get a discussion going, because without that, we can't move forward. Make your voice known to the university. But again, just come to our website, see what we have to offer, and join our numbers in our campaign.
Well, and yeah, definitely, I think people should look at the website, nocollegemandates.com, and look through the list of the universities that do mandate the first round and then also the booster. When making decisions on what to do, it's insane. So, Joni, thank you so much for joining us,
Thank you,
and
Pam.
best of luck. Seriously,
Thank you, and good luck to you, and thanks for all the great work you do in this area.
thank you. Doing my best.
You're doing great.
Thank
Thank
you.
you.